Endometriosis is a condition where the endometrial lining of the womb is found out of the womb. Therefore, it can cause infertility and it can lead to chronic lower abdominal pains. Today's video, we're going to be talking about how this endometriosis causes infertility and how can we treat this chronic pain and this infertility caused by endometriosis. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. If these are the kind of content you like to watch, then subscribe to our channel and don't miss out on any video. Endometriosis is present in about 25 to 35% of women who complain of infertility. That is high. Now, how does endometriosis cause infertility? The first thing is it can form a mass. We said it is inflammatory. I made a video on what endometriosis is all about, how it comes about, and you can go back after this and watch what endometriosis is all about. So it causes this mass and cause adhesions. It can cause scar tissues at the level of the tubes, blocking the tubes. Even the masses which are being formed, it can block these tubes, therefore preventing fertilization from occurring. Therefore, the sperm and the egg cannot meet once the tubes are blocked. Secondly, it can go to the level of the ovaries. If there's endometriosis affecting the ovaries, there's a mass there, and when they go and operate this woman, once they're removing this mass, what happens is that they can remove part of the ovaries, reducing the ovarian function, thus causing decreased ovarian reserve. So these are the kind of ways that it can cause infertility. What are the treatment for endometriosis? The first thing is to manage the pain. If we're managing the pain, if it's just mild pain, we can tell you that, okay, let's just observe, because sometimes it might grow and die in that place, and that's all about it. Secondly, if the pain is too much, they can give you analgesics. They can give you painkillers to manage. Thirdly, you can also be placed on hormonal contraceptives. We said this endometriosis is estrogen dependent. It means that it bleeds when there's high level of estrogen. If you're able to give this person combined oral contraceptives, means that you're putting the person in a kind of pregnancy mode. That's what called pseudo pregnancy. They give you this combined oral contraceptive pills to take for a period of time, then it suppresses your menses. You might not see it for a period of time. So during that time, that endometrial tissue that was somewhere might then remain there and die. But even though sometimes after that it can start back, but most of the times it can die at that area. Now they can also put you in a point like pseudo menopause. So they give you a medication that will be like you have instead gone into menopause. Menopause means you have decrease of these estrogen levels and other female hormones. So once you go into that part, the endometrial tissue, wherever it is going to be resting, and it might even die after that. Now, other treatment depending on the side effect or the complications which has been formed, maybe it's infertility, the adhesions, you can do a surgery, either open surgery or either a laparoscopic surgery, where they go and actually cut out these adhesions, remove the mass and relieve you from that pain. Then if you want to get pregnant and the adhesions are so severe, what can you do? They can do what we call in vitro fertilization, because the tubes are already blocked, so the egg and the sperm cannot meet. They will do in vitro fertilization, where they are going to remove the eggs, take the sperm, fertilize them, and insert into the woman. But now, in cases where it has caused decreased ovarian reserve, what can you do in this case? Most of the times, they usually do what we call, they remove your eggs and store them. They keep them for some time. Maybe if they've seen that you're having this endometriosis, in a long run you might have problems with your ovarian reserve. So they take some of these ovaries and store them. They can store for years depending on where it is being done, and your fertility doctor is going to tell you where to store it and how to do that. So they'll store it. Then maybe you can go about when you want to have children, you go now to the egg bank and you take the egg which has been stored and they do an in vitro fertilization for you. Because sometimes as it increases, it can cause you to have no eggs at all. So in people who have eggs has finally diminished and there is actually decrease or no eggs present, what they can do is they do oocyte transplant. That's they take eggs from another woman and transplant into you. These are the kind of treatment options you can have where the egg is being taken and stored, then retrieved afterwards. So ensure that once you have this kind of pain, don't stay at home, go and consult. Don't buy medications at home, don't try this, don't try this, just go and consult. And once they put you on this medication, they're going to see if it is endometriosis and they start following you up and giving you these medications depending on the complications you have. Thank you very much. If this was helpful for you, give a thumbs up to our video and don't forget to subscribe. And if you want to have a private consultation with us, click on the link on the description box and get to us. Thank you very much and God bless you.